Hi, Dr. Peter Montgomery, family practice doctor, here to share my insights on COVID and the coronavirus with my patients, friends, and family. Hello, y'all. Starting off today here, it's April 2nd with the Kinza temperature map. You can get a Kinza thermometer and they'll download your temperature to the internet. And there's enough, over 1 million sold in the US, and so they can get a pretty good map of where the fevers are. So low temperatures are the yellow, so everybody's doing pretty low, not very much fever right now. Moderate fevers, mainly obviously in the New York, Connecticut, Pennsylvania, New Jersey area, a little bit here in western Tennessee, Memphis area, and Mississippi. When you switch to the atypical, you get a better idea where it's actually hotter than in normal. Florida, the coast down here has been real hot. This has been very consistent, has not really changed much in the past few days. New York is actually cooling off. There's less bright red, more moderate, but still, this is the epicenter in the U.S. as far as hospitalizations. You zoom in, that's Kings County, here's Queens County, and here's Manhattan. And now over here, they give you per county, they give you a fever map. Had a terrible peak there on March 17th there on St. Patrick's Day, been coming down, started going back up, and people did a good job of getting the fever down. Again, social distancing, not spreading germs. Zooming in here a little bit, doing good. Looking up to Boston, they had cooled off very well, started to dip back up also, and said, oh no, we're not going there. And that's probably just people over the weekend getting out to people a couple days later, getting fevers. So be careful on the weekends and getting out too much too soon. Atlanta, home of the CDC. Looking at them, again, they did a good job of flattening the curve. That peak did not get way up there like it did in other parts like Florida. And it's gone down again, starting to creep back up, still in the normal temperature range for this year, and gotten below average. Don't go back up, please. Everybody stick to the program. I know it's hard. Back up to Detroit. Again, cooling off, doing a good steady job of cooling off in social distancing. Chicago didn't get as high as peak as New York or Florida, but starting to come down. St. Louis staying in the boring zone. That's how we want it. Kansas City's a bit warmer than average, but still not bad. Texas, Houston area, steadily coming down, but the most cases there. Phoenix is this orange patch here. LA, staying really cool, colder than ice cold. They are getting cold and even pushing it down, resisting the going back up. San Francisco holding steady. Coming back up, here's Utah, Salt Lake City, and again back up to Washington, Seattle area. Very warm, but they're keeping it down and getting below average. So everybody's doing a good job. This is kind of like, how are you doing a social distancing map? How are we doing overall? I think we're doing very good on that. Testing, US, how are we doing with testing? Again, steadily over 100,000 a day, every day. The labs are behind, but the lab numbers, we're in the 65,000 or holding more in the 60,000 range. I think they're starting to catch up. I'm actually starting to get results on some of my patients. So that information is coming in. Being able to give some good news to some people. So looking to the world, over 1 million. This is a bad day for the world. Over 1 million confirmed cases. It's safe to assume it's probably 10 times that number of people who weren't all that sick and didn't bother getting tested, or people who were sick and wanted to get tested and couldn't. So it's easy to say the number's 10 times that. The death number is very accurate, though. People are dying. They're checking that out. For the world, still a straight go. The log rate has been pretty straight, maybe a slight bend there daily increase of cases, not quite as steep as it was based on testing numbers, but the countries that are testing reasonably well, U.S. is still going up, maybe a less intense, maybe more intense, hard to say. Italy, who's had the worst case of it, is definitely a steady decline. Their peaks are all steady, their troughs are all steady, so that's a steady decline down. Spain is flattened out, not really declining, but flattened out. Germany and Europe, Germany and Poland's done the best. Germany still had a pretty high number. Dropped, raised, hard to tell what's going on there, still too soon. France had a big spike and down. I don't know if that's an abnormal number or that's an abnormal number. It's going to take probably a couple more days to get an idea. Across the channel, UK is still going up. Switzerland, between Germany and Italy, flat and coming down. Belgium, the Netherlands, right there between France and England, flattening out. Up into the Nordic countries. Sweden's done the worst of the Nordic countries and still rising. They've intentionally not done any social distancing. People in Sweden say we social distance all the time. With the largest number of people living singly in Europe in their own apartments. But that's probably still not good enough. Norway, right next door over the mountain ridge, had a big spike and seems to be flattening out. A very unusual pattern, hard to say. Finland, gotta scroll way down to see Finland's numbers. Finland did not get as much. Finland's about the same size as Norway, so it has dramatically less. It's half the size of Sweden. That is definitely a big spike and flattening out, possibly coming down. Now, Finland's right next to Russia. And Russia's mentioned very low numbers. Pause here for a second while I find them. Large country over 150 million, but they've been rather low for a while. Steady increase and a big jump. Moscow is on lockdown. I think it's just been delayed getting there. I think they've done a good job possibly delaying it. At first, I thought their numbers were suspiciously low, but sadly, it looks like it is picking up there. Maybe that's why Finland's doing well. There's not a lot of contact between Finland and Russia. So that might be part of the reason why Finland's also isolated, from Sweden. So they're quite isolated. Maybe it's their isolation why they're doing so well, or maybe because they have a habit of taking a sauna on a regular basis, getting their body hot, and boosting their immune system. So I like to believe in that theory. So I make sure I get a good exercise each day for the past couple weeks, get a good hot sweat. If I'm not in the mood to run, take a long hot shower for 15 minutes, get the body temperature up. A bath would actually do it better. So that's kind of the breakdown on the countries as I see it. There is another map that breaks it down just in graph form and also tells some more interesting things. They give a world average, again, the over a million cases, and death per 1 million population. 6.88 is the world average. Again, a lot of very large countries not reporting well at all, not testing at all. But of the reported countries, 6.8 per million. So that gives you kind of an average. If you're better than that, you're doing good. If you're above that, you need to keep working on it. USA is at 18. Italy and Spain are the worst. You can click on this, and Germany's, up there too. Now this is by case numbers, total cases. So if I click the button here twice, San Marino is basically a self-isolated country. It's really just a large city within Italy. And that's why the numbers are so large, is because Italy's gotten hit so hard. Here's the number for Spain. Andorra's between Spain and France is rather high. I'm just wondering, did they get a worse strain? Yes, they live in more multi-generational households, a lot more spread, and did not really clamp down on the social isolation early enough, or did they just get a worse strain? Because pretty much all of Western Europe numbers are really high. France and everybody touching France. Belgium, Netherlands, Switzerland touches France. Luxembourg touches France. Andorra touches France. United Kingdom with the Channel, a little bit of protection. Really, here's Monaco. All those areas are, Denmark is right near, just north of Germany. Big conglomeration, well above the world average of 6.5. Coming down, I mean, the U.S. is at 18. We've had definitely our pockets of nursing homes in New York City having a bad time. You can click on the U.S. and it'll give you state by state numbers, not deaths per million, which gives you an idea how they're doing. California, if we go by total number of cases, New York is the highest, New Jersey next door. California is a very large state, but not the biggest number of cases. Seems to be growing in cases, though, but not getting this in graph form. I'll have to find that somewhere else. Going back to the world, the reporting gets a little more sparse as we get down here on the lower countries, but I think that gives a general trend. Europe is starting to turn the corner. America, not yet. But I get the impression that New York, which just got hit hardest and first, is starting to turn the corner, and then the rest of the country should follow suit this week. New cases turn the corner. Deaths continue to rise as there's a delay from feeling sick to getting worse. With this Worldometer site, if we go up here, it's Worldometer. They have wonderful, useful graphs of information on all kinds of things. And they do have a separate one on the coronavirus. They break things down by symptoms and incubation periods. Most of the cases are mild. Remember that. Most of the cases are mild. It does get worse as we get older. 1% of the deaths are people less than 50. 99% of the deaths are in people over 50. And again, most of them over 60. Let me find the better chart that I had here earlier. Pardon me as I scroll online here. Breakdown by age and sex and pre-existing conditions. Again, if you add up all these numbers down here under 50, that's 1%. 50 to 60 is another 1%, and most of the death rate by cases are above that. Breaking down by sex, men definitely are dying higher than women. It's well known that men are not as healthy as women, especially as we get older. More men are smokers. More men don't take care of their health care. As a doctor, we're told the stats. Women visit the doctor 4 times as much as men. And the woman decides where the health care is. The business of medicine is make mom happy. Mom decides where the family goes. And make mom happy, and you're going to do better in business. And married men live longer because the wives nag. Keep it up. We need it. And everyone will say, me and my husband both had the same flu, and he was a baby. He was down for days more than me. Yes, men do not do well with infectious diseases as better. Taller, more muscle mass, stronger, faster. Yes, but infections? No. Men, die younger as far as mortality rates. So this might be part of it. Bad habits. I think a lot of guys get stuck in the 8 and 10-year-old macho mode of, I'm not going to take care of that. That's for girls. Girls do that. Boys do this. Boys eat bugs off the floor, and all these bad habit things that we do. So we need to stop doing that. Again, one of my phrases is, now is the time to be the most excellent version of yourself. Think about yourself, all the things you want to do to improve. Now is the time to do it. Now is the time to stop smoking. Here's the list of diseases that are more likely to get you killed. If you've had cancer in the past, it's not actually the worst thing. Just having high blood pressure is worse. Good time to take your blood pressure medicine. Good time to eat less salt. Good time to get more exercise. Chronic respiratory diseases. Good time to quit smoking. You can't do anything about the past, but good time to quit smoking now. Diabetes, you're going to be eating excellently and doing the best you can on that. Cardiovascular disease, which is made worse by all of these. So controlling all these controls your cardiovascular disease. Take your medication. Listen to yourself. If you're starting to have chest pain, do not avoid the emergency room. Um, so the only other part I wanted to mention was one on incubation period. There's a variability from the time someone sneezes in your face or you touched a surface and then touched your own hand, mouth, or eyes. 2 to 14 days. Average seems to be about 5 days. So, if you think you picked it up, about 5 days. There's another chart about 5 days from picking it up, and another 5 days to shortness of breath. So a total of 10 days at that point, about 12 days to hospitalization, and 14 days to advanced respiratory distress syndrome. So once you're short of breath, hesitation to get to the doctor is not doing you any good. Do not be hesitating to get to the hospital if you're starting to actually get shortness of breath, pain in your chest. Those are very, very, very serious symptoms. I'm being aggressive with my patients, getting them on Zithromax. And while I'm waiting for a COVID test, uh, once I've got the sample, I'm waiting the results, which is taking quite a while. I'm getting them on the hydroxychloroquine. I've been having very good results with my patients. So far, none of my patients I put on the outpatient treatment have wound up in the hospital. Very small numbers, not a clinical trial by any means, no placebo group because that would be unethical. Just following the advice from the Chinese group and their published data that timely initiation of antiviral medicine was essential. So we know these antiviral medicines exist. Every pharmacy I've called has them available. The hospitals are stocked up on them. And so doctors out there, please do not hesitate to do prudent medical care. It is prudent medicine that while you're waiting on a test result to start reasonable expert opinion, which is the lowest level of advice. Level C is expert opinion, and we have expert opinion, and level C is medical wisdom to follow until you get better advice. There is some level B advice from research tests showing that it can even suppress people getting in the first place. That was only done in animal tissue. I would only give that in people with extreme risks, people in their 80s. Would I ever consider putting on someone on someone in their 80s or someone with severe medical problems? Would I consider putting them on preventative medication? Again, I tend to be out there. Everything I've said that's been out there a week later is found out to be the norm. Been wearing masks, in the office for over 2 weeks now. I'm now saying everybody should wear masks. Yes, been wearing masks in public, and now everybody's saying, "Oh, wear masks." I think constantly keeping up on the data can help you live a few days or a week in the future above the advice of our leaders who seem to be rather slow to get it. So if they could all get their act together, follow the advice of the experts who know what they're doing, and if the political leaders would follow them sooner, we would all be doing a better job. And that's worldwide advice. So everybody keep doing the best you can. Washing, waving, wiping. Whoa, don't touch your face. And we are all in this together. Be the most excellent version of yourself for your health. Be the excellent to each other in dealing with close quarters and living with people and living with family and friends and coworkers. And everybody hang in there, and I'll give you another update tomorrow. Thanks. Bye-bye.